Welcome to the Fibromyalgia Podcast. I'm Tami Stackelhouse, fibromyalgia coach, author, and founder of the International Fibromyalgia Coaching Institute. The goal of this podcast is to empower you with access to the dream team of experts and coaches I've discovered are key to living the fibro life you love. From the comfort of your own home, and maybe even your pajamas, I'll help you take back control of your life and health. To help out with fibro fog, I always include full show notes and additional resources at fibromyalgiapodcast.com. Welcome to the Fibromyalgia Podcast. I'm your coach, Tami Stackelhouse, and this is episode 142. In today's episode, I'm joined by Coach Deb Thompson as we discuss some practical fibromyalgia surgery tips that you need to know if you're facing any major medical procedure. We'll talk about ways that you can prepare at home, how to talk with your anesthesiologist, your doctor, and surgeon about your fibromyalgia and your needs, as well as some things you might need to do differently with your medications and supplements to prepare for surgery. Deb has recently had her third major surgery in 8 years. She's had her second hip replacement. She's going to be sharing what was different about her most recent surgery versus the prior surgeries that she's had and what she's learned in the process. So often, my clients put off surgeries that they really need to have because they're worried about the inevitable fibro flare that's coming. Now, today's episode should help you put that possible fibro flare into perspective, as well as give you tools that will empower you to make that flare as minor as possible. Now, let me introduce you to our guest. Deb Thompson is a certified fibromyalgia coach who works with women to help them break the cycle of pain and fatigue. Many of her clients are chronically busy and overwhelmed with their responsibilities. They often put themselves last and are prone to pushing through. You might be able to relate. Now, coping with fibromyalgia and chronic pain while undergoing major surgery has given Deb a real insight into what our bodies need before and after this stressful event. And she's put together some free bonus resources that she will be sharing during our episode today. As always, the information included in this podcast is meant to be educational and it's meant to encourage you. It should not be considered medical advice, nor is it ever intended to replace consulting with a qualified physician or other healthcare provider. Deb and I really hope that you will take the tips that you learn here today and talk with your own providers and your own surgeon about what might work for you in your situation. Be sure to keep listening after my conversation with Deb for some additional resources that will go more in depth into some of the topics that we cover here today. Enjoy my conversation with Deb. Hi, Deb. Welcome to the podcast.
Good morning, Tami, all the way from New Zealand. Well, it's afternoon for you and morning for me, right?
Yes, and winter for you and summer for me. So
Yes, absolutely.
Well, I am so excited to have you here and to have you share some of your most recent experience. You know, when you emailed me and said, "Hey, I think we should do a podcast about going through surgery," I thought that was brilliant. And it's actually been on my list for a long time, but having done this, I think this will be a much more interesting and helpful episode for people. So thank you for doing this.
You're welcome. I mean, so much blowing my mind, really.
So as we get started, of course, I just read your official bio. You know, you're one of my coaches. You went through the training program. You're a certified fibromyalgia coach. But of course, you are also a patient. So why don't we back up a little bit and kind of start with a little bit of your fibro story. When were you diagnosed? What was that like for you?
Well, if I can just go back before I was diagnosed, because I actually think I had fibro for a long, long time before I was diagnosed. I remember a time when I was a child and I had a virus and I was terribly fatigued after and basically missed almost a term of school. Other viruses along the way really failed me, but I didn't even think about fibromyalgia until after I got chronic pain, and that was 11 years ago. And once I got chronic pain, everything became a little bit harder. And so I started to think about the other things that were happening to me that were unrelated to the pain that I had, which had started with a fracture in my pelvis. And I started to realize there were other symptoms. And so by 2020, I was feeling pretty distraught about it all. I'd been to the doctor a lot of times, like most people had. I'd gone through all my symptoms, I'd had all the tests. And so eventually I was with the local pain clinic here. And eventually I got an appointment with one of the doctors there who went through all the things and said, yes, I'm pretty convinced this is what you have.
And that's when you were diagnosed?
That's when I was diagnosed. Yeah, just 2020. So it was a long time to wait.
Yes, yes. And how long had you been dealing with the chronic pain and other things prior to that?
So in 2013, so 7 years before I found out I had fibromyalgia, I fractured my pelvis, but I didn't know I'd done it, and they missed it on an X-ray. So the pain was terrible, and it just got worse and worse and worse. And because it was in my abdomen area, there was, again, a whole lot of investigations about different things it could be, and no, it's not this, and no, it's not that. And finally, my doctor said to me, if you are feeling really bad, just take yourself to the hospital, which I did. And they literally came back and said, oh, we've accidentally found out that you have fractured your pelvis. And after that, it was discovered that it was seen on an X-ray in April. So I guess at that point, it was about what you would call the dirty pain. You know what I mean? I had the pain and it was getting worse and worse. And a lot of that was inside my head because I was so stressed about it. Sadly, I'm not a person who slows down. And I had a job, I
I'm
had
sure
a
someone
family.
listening is laughing with me and nodding their heads. You're not the only one ever.
Also anyone that knows me. And so I just kept going, really. I mean, there were a lot of reasons I had to. I had to go to work. I had a family and an elderly mother, but that was not a good approach. I'm not sanctioning that approach because basically it led to me losing all the cues that I had in my body about what was going on. I've always been a bit of a boom and buster, probably right from that small child, really. But I also had lots of things. I mean, I'm a person who likes to do things. It wasn't just gritting my teeth and getting on. I like opportunities. I was having work opportunities and opportunities to do things. So I just kept going, and that was not good. It was not good. I had gone to the pain clinic and I had found lots of great people, lots of great resources. And again, I'm a researcher. So I'd sit there and I'd work out all these ways that I could make my pain less, but I couldn't actually put those into practice. And I think, to be fair to the lovely pain clinic where I still attend today at relaxation class, I was given the best support and I understood it all academically. But because I didn't have any support, I actually work out which of the bits were right for me. But I think the key thing was that I didn't accept that I had to change things. And acceptance is a very, very difficult thing to get. One of my favourite quotes is by Cheryl Strayed, the wild woman.
Mm-hmm. The book Wild?
The book Wild. Acceptance is a small, quiet room. And that's exactly how I pictured it. It was like, it's very small, it's very quiet, it's very dark. I couldn't find it. Anyway, the upshot of that is finding your podcast. Once I realized, well, actually, it was before I realized I had fibro even. I just knew that that's what it sounded like. So I started researching and Tami Stacklehouse. So I started listening to your podcasts and I was pretty convinced pretty quickly that, yes, that's what I had before I got my appointment, but also that I need a bit of what you had. And I watched one of those stories of hope and healing that you do and are wonderful because you get to see people who have done your courses, your advisor course and your coach course, and they're talking about what they've learned and, how a load is lifted for them, really. And I saw the wonderful Julie Schiffman, who was my coach. Yeah, I was like on it like a ton of bricks. I need that woman. And also because I could see myself in her. She was a mother, a grandmother, a person who loved life and was attacking things all over. Yeah. So once I found her, that was really, really the start of the acceptance piece. I mean, she was a mentor, but a cheerleader, but she kept me on the straight and narrow when I started to veer off, as I often did. Yeah, so finding her was the key. And then once I'd found her, because by trade I'm a teacher, I realized that actually this was something I could do.
Mm-hmm.
I could become a coach. And, it was a way to give back. I've always thought that that's really important. Once you start to know how you get your way through a difficult and challenging experience, then it's really important to give that to somebody else.
Mm-hmm. And you don't have to have it all figured out either. In our Be a Coach series, podcast series, which we will link to in today's show notes, one of the things I talk about is that you just have to be a few steps ahead, right? And you can reach back and help the people behind you. So, yeah.
And I think one of the reasons I reached out to do this is because it's been a bit of a cha-cha, although cha-cha is not what I can do at the moment, having had my hip replaced. But do you know what I mean? Like I had got so far forward that doing an operation puts you back a little while. That's just completely normal, right?
Mm-hmm. And that's an important thing to bring up. I've talked to a lot of clients who are considering whether or not I should do this surgery. You had hip surgery, but, knee surgery or shoulder surgery or whatever it is. And it's always this big concern because when we have the surgery, we know it's going to flare everything up, right? We know our pain is going to be worse. And talking through that, but once you get through that worst part, for most people, it's so much better because whatever it is that you're getting fixed is a trigger for fibro pain. And so if you can
Absolutely.
fix that, once you get through that flare up, it's so much better.
Yeah, and I think because this is my second operation, and we'll talk about the difference, I went into this one more willingly for a reason that was a better reason, if that makes sense. I get a lot of back pain, a lot of SI joints are not great. I've got discs that are not great. I know that walking makes those things better. I know that gentle exercise, which we've talked about many times, needs doing slowly and working on. And I just got myself to a point where I was starting to really feel like it was helping me. And then my hip was starting to get worse. So at some point, you've got to make that decision to go, okay, in another 6 months or however long it takes me, I'll be better to be doing the things that I know help the other things. But I just had to do this fix before I could get there because it was starting to get in the way.
Right, right. Absolutely. So let's talk a little bit about, two surgeries. You said they were very different experiences. So let's talk about the first one. When did that happen in terms of like your fibro story? Was that before you were diagnosed, after you were diagnosed?
Yeah.
Okay.
It was before I was diagnosed. I think what had happened was the start of my chronic pain journey was 2013. And because it was a pelvis, I was sort of funneled into orthopedics quite quickly. And once you are in a medical system, they generally are able to find other things that need doing. But also because the pain in my pelvis was not shifting as it should have. And I would say that was generally about a heightened nervous system. I understand that now, having had all that fear and worry about it beforehand. I was just at a level where my pain was out of control. So they started looking for other things, which is what a medical approach does, fair enough. And my other hip, it was identified that I had torn a labrum, which is just something on the outside of your hip. Starting to not be very technical here because I can't remember exactly what it is. Lots of people tear their labrum, and you can do it through exercise, but mine was because of faulty anatomy in my hips, and it had just sort of worn away. So they suggested this operation, which I had, which made absolutely no difference to me. This might not be other people's experiences. It's just my experience. I just need to be really, really clear about that. And I also had to toe tap for 6 weeks. I couldn't put my foot on the ground. So that was really exhausting. By this time, I didn't have a lot of sick leave left for work. So I was going to work on my crutches, trying to do my daily life, everything wasn't any better. So between 2014, when that operation happened, and 2016, when I had the hip replacement, nothing got better. Nothing got better at all. So by 2016, I went to an orthopedic surgeon. I went through the hospital system and then to an orthopedic surgeon who said to me, let's fix that hip. It's not an unusual hip. Both my hip balls are very tiny.
You are very tiny, Deb.
feel that tiny these days, but we're not really talking about the bone structure there. This is causing these issues. It needs to be done. So the problem with that was that I was still a state of mind that I could be fixed. This would solve all my problems. Despite what I'd learned, I was really looking outside myself for somebody to fix my problem. I was working really hard. I had my elderly mother who was starting to head toward dementia. I had a lovely family, a grandchild at that stage. I just didn't prepare myself in any way for this not being something that was going to work. And I
Right.
worked
Yeah.
right up to the time. I was highly stressed because I didn't want another operation. I'd only had one just couple of years, well, not even 18 months before. So everything was really stressful beforehand. I've talked before on my Instagram account about the pain gauge and how everything is like a load. So think about it like a fuel gauge, and you start at no pain. Every time you put something in, be it an operation or something emotional or physical stress or whatever, it's just going up, up, up. So basically, when I had that operation, it did not go down, even though physically my hip was a lot better. And one of the reasons for that was I didn't have any sick leave. I had to go back early. Everything just sort of piled up really to make a much longer recovery than it should have been. And one of the things, to be fair, remember them telling me, which shocked me quite a bit, was that because of the thinness of my hip cup that sustained a little fracture. So then I had to do that
During
blinking
the
toe
surgery.
during the surgery.
Yeah.
So then I had to do that blinking toe tapping thing again for another 6 weeks. And I was pretty exhausted by then. So that wasn't a great experience. My hip is now absolutely fine, I have to say. It's great. Yeah, better than ever. But it wasn't something that I went into my eyes open. I didn't have great strategies, and I came out of it worse off for a while.
Mm-hmm. Right. And without the tools to know what to do with it being worse off, right?
Yeah, to be fair, I did have some tools, but I wasn't doing them. So, the pain clinic were great. I understood all the theory, as I said before, but I just,
Putting it into
threw myself
practice
back
is a
into life.
whole different thing.
Too
Yeah.
hard. Well, it was too hard then.
Yeah. So let's fast forward. Now, for the last, I don't know, almost as long as I've known you, you've been knowing that another hip replacement was eventually coming.
Yeah. Putting it off is probably what I'd say.
But with those kinds of things, they don't want to just do them
Oh,
willy-nilly.
no,
You want to make sure that you really need it and that it's going to
absolutely. Yeah,
last as long as it can and all of that. But
absolutely. And that the time is right in terms of what you've got going on in your life, you know?
yeah, because it is major surgery.
It's major surgery. Yeah.
Yeah. So let's talk about this time. First, let's talk about, before we get into all the details and the strategies, give us an overview of how this time went as opposed to the first time you were just telling us about.
Okay, so first I had the benefit of hindsight. And some of the things that didn't go well the first time were sticking to a pain medication regime afterwards. I had extreme pain, which I now know was partially because I had a fracture, and that was not my fault. But I also was not really understanding what I should do with the pain medication. And that was because previously I had taken a lot of big gun medication, and it had taken me quite a while to come off tramadol in particular. And so I was really reluctant, but I wasn't asking anybody any questions about the best way to do it either. They would say to me, "Would you like these drugs?" And I'd go, "Do I? I don't know." It was hopeless. And so I didn't help myself in that regard. Whereas this time, lovely Giselle, who's one of our fibro coaches, offered to talk to me because she's got a medical background about just explaining to me really, what the different drugs did and at what point would I think about taking what and why I would consider doing it and thinking about it as a short-term fix. And that really changed my attitude there, that's for sure.
It does. It does. And we'll get into some more for you listening. We'll get into some more of those details in just a little bit. So if you're listening and you're like, okay, but what did she say? What do you want? We will talk about that in just a minute.
Yeah, it's coming. It's coming. But also, I knew that whole thing about the load of all the different things making your pain worse. So I really pulled back. I ramped up, I suppose, all my strategies that I have.
Tried to bring that needle down.
I tried to bring the needle down as far as I could. And we're 8 years on, Andrew and I live alone now. I haven't got mum. bless her heart. I knew I could actually manage some things. And a lot of that was about calming my nervous system. So for anybody listening out there, I would say anything that you have that is good for you to calm your nervous system, do it on overdrive.
Right.
I did a lot of that. I ramped up my sleep routine because actually, I probably should have said that first because for me, and I think for a lot of fibro people, that is the key piece that we are
To
missing
everything.
to everything. Yeah.
Yeah. I
The
think of
longer
it.
I do this, the more I believe that.
Yeah.
Yeah.
Yeah. I kind of consider it sort of the keystone, right? If that piece
Yeah.
falls out, the whole thing falls apart.
Absolutely. And let me tell you, there's several steps to my sleep routine. It's not just a one thing, it's a scattergun approach. And I tried to not do too much in the days leading up to the surgery. I really tried to get other people to help me, which I've been very bad at doing in the past. And I'd suggest, I thought about this, what if you live alone? I think there are other things that you need to do. And basically, it's breaking everything down into very small bits.
Mm-hmm.
And just everything takes longer than you think it's going to.
So, how did you come out of this surgery? So, compared to the first time, how was this one?
Well, even from the pre-surgery bit, a million times better because I had, thank you, Giselle, with information to ask about medication. I have no shame now about the fact that I have chronic illnesses. It's not my problem if somebody else cares about it. So I asked to the anaesthetist beforehand. When I went to the surgeon, I was just upfront. I said, I've got fibromyalgia and this is the way it's going to affect me afterwards. It will be harder for me. It will take me longer. I will be tireder. I will need these things. And that was perfect. They were really, really helpful. And because I had the same surgical team, I know that they did things differently and they listened to me,
That's excellent.
which was really good. And I mean, probably they'd have done the same the first time, but I didn't know to ask.
Yep. And for you listening, we will be telling you shortly what you
Yeah.
can ask.
Yeah. So there was that. I chose a different hospital because I've got health insurance I could choose. And the one that I went to was very small and very personable. And everyone
This
was just
time
lovely.
was
This time,
small.
this time. I don't know whether I could have chosen a different one the first time, I'm not sure. But this time, definitely, that really helped. I stayed on top of the drugs. I was lucky this time, there was no fracture, and I was able to put my foot on the ground, and that changed my mindset somewhat. I was like, well, I'm already 6 weeks ahead. So, yeah, I just felt like I had that. Do you want to talk about afterwards, or do you just want to talk about?
Yeah. So there was one question I was going to ask you really quick. How far out are you from that surgery right now as we record this?
It's in a little bit weeks.
And how do you feel? I mean, obviously, like you just said, you were 6 weeks ahead because you could put
Yeah.
weight
Well,
on
I
your
felt I
foot,
was.
but now you're not so sure.
Well, the thing was, Tammy, that I had planned, in my own way. This helped me. I had planned, I'd done everything that I had known was good for me. And yet, when I got home, I had a bit of a crash, I have to say. And in retrospect, that was probably always going to happen because I was very determined because my lovely Andrew, my partner, has been looking after me for 11 years. I really wanted to be independent. So I got all the practical things together that I knew that I could bag with stuff, pick her up, all the things. So I thought I'll be able to do all these things myself when I get home. But I had forgotten that just because you step out of hospital doesn't mean you're not still at the stage that you were when you were there. I think coming down off those big drugs that we'll talk about in a minute, I know tramadol makes me cry, which is one of the reasons I stopped taking it in the first place. And I just spent the first week crying, which was very disconcerting for poor old Andrew, who, a man,
Yeah.
a
Yeah.
lovely man, but a man. And I think it was a combination of the drugs, the exhaustion, recovering from surgery, but also there was quite a lot of grief there about the first time, the second time, fibro, having pain. And so I think the key here, and something that I would share with other people, is there was a point, maybe a couple of days in, where I said, I'm just going to let this happen. That's okay. And I did. I just cried for the week. I watched lots of television. I just let it roll over me. And poor old Andrew wandered around going, what's going on? But I
I
guess
think I
yeah.
think the men in our life like to fix things and they
Oh,
can't
definitely.
fix this, and so they
Yeah.
don't know what to do with it.
Exactly. But
Oh my
so
goodness.
just allowing that to happen really was a change for me, I think. I wasn't trying to bash it. Well, it wasn't a change because I've learned how to not bash this thing over the head. I'm not bashing my healing over the head anymore, but I did know. My mother used to have a great saying, and she'd say, "It's okay to melt down, but don't unpack your bags and stay there." And so I just kept that in the back of my head. I mean, I wasn't going anywhere. I was just sitting on the couch with my tissues. So it was actually fine. And it made a lot of difference. I felt like I'd got a lot out when I went through that slightly cathartic experience.
So true. So true. Well, let's start getting into some of the practical things because I know that's what you're listening here for. So let's dive into that. And I just want to remind all of you too that any of the resources that we mention are going to be available on today's show notes page. So it's fibromyalgiapodcast.com/142 for episode 142. And I know Deb's got a lot of goodies for us here. So we will have links to those where you can connect with Deb on that show notes page. So let's start at the pre-surgery. What are some of the things that, because you guys, the key to fibro living really is planning. It's planning and it's also taking ownership of what you need. So, like Deb, you just briefly said this earlier, but I kind of want to highlight it, right? Like you know what you need. You live in a body that has certain needs and you know what those needs are, and it's your job to communicate them. It is nobody else's job. And we also have to own that nobody else is necessarily going to know what we need. Even Andrew, you guys have been together a long time, right?
Yep.
He still doesn't live in your body and know what you need, right? So I know we're going to talk about communication, but I really wanted to highlight that the more we can take ownership of what we need and to be the one that makes sure that we get what we need, right? Like it's nobody else's job, it's yours.
Absolutely. Yeah.
Yeah. All right. So, what did we do to prepare?
Well, I'm a great fan of a weekly planner for a start off. That helps me keep myself in check. So I did write myself a list and say, okay, these are the things that need to be done. And I looked at the list and said, which of those things do I need to do?
Great question. Because just because they need to be done doesn't mean you're the one who has to do it.
Exactly.
Yeah.
So, for example, some things needed to be picked up, literally, because I have an operation where I can't bend to the floor. I needed a picker-upper. I needed something to store my crutches in. I needed two picker-uppers. I don't know what the technical term is, but it's the thing that
Those little grabber things.
getting the
Yeah.
things off the floor, because you would be surprised at how many things fall or live on the floor. Just this morning, I dropped my cottage cheese. I was like, no, is it gonna? No, it's good. Picker-upper. Drop water bottle. So I needed to get all those things, and I knew that Andrew would do that for me. So I just made a list and sent him out with it. Practical things like our bed's very high, and I got him to make a little stool. Well, it's more of a platform. And sweetheart, he's put sort of like a tape around the outside so that I can see the edge. So those things. The big thing I would say, no matter what operation you're having, is getting your bed made. Now, I don't know how many times I've talked to clients about how exhausting they find making up their bed, changing the sheets.
It's a workout, man.
Oh, it is. And I knew, I mean, again, I could have asked Andrew to do it, but I don't want to ask him to do everything. And I have a really lovely friend who's always wanting to help. And she came down and helped me change the sheets. Somebody I know, one of my lovely daughter's mother-in-law, has just had a knee operation. And she said to me, one of the tips that she was given was to actually put a couple of layers of sheets on. So you might not get a fitted sheet on top of that because that might be quite hard, but just to put a couple of flat sheets, because one of the things that happens after the operation is you sweat, and that is all the drugs coming out, and the fact that you're probably not moving very far. You're trying not to move.
Well, healing takes such energy and
Such a lot of energy.
yeah, yeah.
And so that was a tip that I didn't use, but I would suggest.
So instead of having to change all of the sheets, you
Yeah.
would just take a layer off.
Yeah.
And then
Take a layer
ta-da,
off.
fresh
Yeah.
sheets.
Yeah, exactly.
I love that.
So that's something I would definitely, it just sort of like keeping stress to a minimum. Again, my planner, really helpful here. Looking ahead, knowing when I was having the operation, trying not to load myself up with too many practical things to do, but also too many things that might make me go into overdrive. And I guess the other thing is I felt really in control this time, don't get me wrong, but I was overwhelmed. So back to basics with my fibro. I think I said to you before, I felt like I was in fibro kindergarten. I'd gone back to all the things that I knew that I
Yes.
needed to do. And I've actually made a list of those things, and people can find them. I've put them in the show notes because I just found them super, super helpful for me. And it's so easy and it's completely free. Breathing. And I know we
Hmm.
do the breathing all the time, but
Yeah, because if you weren't, you would be dead. So, but
so the
intentional breathing is a whole different
intentional
thing.
breathing to relax myself many more times in a day than I would normally do it. And it meant that by the time I actually they made me walk to the operating theatre, I actually just felt fine. Like my heart wasn't beating out of my chest or anything. One of the other things I would do is, I guess, can we talk about the communication, or is there anything you want to talk about this?
Yes, but before we move on to that, I just want to highlight something that you mentioned, and I just kind of want to say it a different way to make it super clear to people. You really cleared your schedule, right? Like, so when we're talking about doing things to calm down your nervous system, that doesn't mean keeping your calendar chock full to the very last minute where you're driving to surgery, right? You need to clear that out. You need to thin out your schedule. You need to do less things. You need to plan all of that out. The other couple of things that I want to mention in terms of preparation before we talk about communication is there are some practical things from a medical perspective. And I know you didn't have to deal with some of these, but a lot of you listening, you might be on low dose naltrexone. And if you're not, hit that fast forward 10 seconds button because this won't apply to you. But if you are on low dose naltrexone, naltrexone blocks your opioid receptors, which means opioid medications don't work, which means you want to make sure you stop taking that long enough so that the medication they give you during surgery and during recovery, so that stuff can actually work. Now, you might, talk to your anesthesiologist about this, and they may not even be familiar with low dose naltrexone and how we use it. So this is something that you probably want to go to your pharmacist wherever you get your LDN, but you definitely want to stop taking that probably at least a week, maybe longer before surgery, and not start taking it again until after you're done with your pain meds. The other thing is when you start retaking that, you might need to start again at a lower dose, just depending on how long you're without it. So that's one thing I wanted to mention. The other thing I wanted to mention is pain meds themselves. If you are somebody who is taking high doses of tramadol, Vicodin, any of those opioid pain meds, if you're taking high doses of them and then you go and have surgery, you're already taking a lot. So there's like nowhere to go. So if it's possible for you, again, something you want to talk to your pain management doctor about, maybe even the pharmacist about, is there a way for you to decrease some of the pain meds that you're taking for a few weeks before surgery so that the pain management during surgery and recovery can work better for you? So maybe you can take different things, lower doses, deal with the pain maybe for a couple of weeks. But that is a really important conversation to have because a lot of times people will go into surgery, they're already taking so much, and then they don't get the relief that they need with pain meds during surgery. And then the last thing, the third thing I want to mention kind of along these lines is there are so many medications and so many over-the-counter supplements that we take that can cause blood thinning and can cause you to bleed more. And these are all things that also should be stopped. So when you're having your conversation with your surgeon, with your anesthesiologist, with all those people about what you're taking, make sure you mention all those over-the-counter medications and supplements as well, because there's a lot of things you might not even think about. Deb, I know you mentioned to me you take CoQ10, and that was one of the things that you had to stop.
I just had to pull back a bit because I was taking the recommended dose, which is
For fibro is higher.
for
Yeah.
fibro, that's higher. So I just pulled back a bit. And they were really good at asking me in enough time what I was taking, and I put it all down.
Yep. A lot of these things need to be stopped, a few weeks before. Another thing that I've been hearing about recently, the GLP-1 medications that people use for diabetes or to help lose weight for inflammation. those slow down your digestive tract. They slow down gastric emptying. And you have to clear everything out often before you go into surgery and things like that. Sometimes these GLP-1s have to be stopped much farther in advance because it slows everything down going through your system. And so sometimes you have to stop those a couple weeks before so that your system can get back on regular speed for clearing things out for surgery. So just a few things I wanted to mention. Like I said, Deb, I know these weren't necessarily part of your experience, but if we're talking about surgery, these are also factors you guys are going to want to talk with your doctors
Yeah,
about.
everyone's different, right? Everyone has
Yep.
different medications.
Yeah. So communication is such a key thing. And sometimes it can be hard to know how to do that and how to do it in a way that's actually productive, right? Like just saying I need help is not a productive way to actually ask for help.
Yeah. And I think, again, the no shame approach, I have fibromyalgia, this is what I need, and stop talking then, and then they can go whatever they're going to say, is a really good place to start. I was so lucky. I went to my pre-op appointment and I sat down with the nurse who was doing all the stuff, and I said to her, I've got fibromyalgia. And she said to me, oh, I've got fibromyalgia. And that was the best thing ever, because we had a really big conversation. And again, from a medical perspective, she was able to give me just a few clues. And my biggest thing was I wanted to speak to the anaesthetist earlier than I had done the last time. It had been, him in his gown and hat the last time, whereas I wanted to get him the day before and have a good chat. And that's exactly what happened. Armed with the knowledge that Giselle had given me about keeping ahead of the pain, which of course is super important and something I spent years not doing.
Yes. For those of you who aren't familiar, I like to think of pain like a runaway train. If it gets away from you, you cannot catch it. And so it's much better to think proactively, how do I prevent pain rather than how do I alleviate pain once I'm in pain?
And for me, having that background from the pain clinic, that is a lot of ways. It's not just medication for sure. It's a lot of ways. But in this instance, in an acute situation, I need to focus on that medication. And so armed with what Gisela had said to me, I went to the anaesthetist and we talked at length about what the different things that he would offer. So I knew that
What your choices were
I
going to
knew
be.
what
You
my
got the
choices
menu
were.
ahead of
I
time.
got the menu. I was like, oh, I'll have that for an entree. And also when to step up to the next level. It was like a hierarchy. And I had to do that because nothing was cutting the mustard and I get a bit sick on morphine. And so I did get it right a lot quicker. And that made a huge difference, an absolutely massive difference.
And in that conversation that you had with him, did he give you some guidelines like, if your pain gets to this level, then we need to do something different, or like what the clues might be?
Yes, absolutely. And I've always found the pain scale very difficult.
Yeah, so many of us do.
And so I was more feeling like I'm going to tell you, well, not him because he wasn't there, it was the nurses, when I'm starting to feel a bit stressed about this. And I'm going to also preempt. So if you offer it to me, I'm going to take it, which I didn't do the first time.
Right. So often we're like, oh, no, I can tough it out for
Yeah,
a little
no, no,
longer.
no, no.
No.
So I think that those two things together really help. So they'd come to me 4 hours later and go, here. And I go, thank you. And take it. Also, I was very clear when I knew that it was time to move up that hierarchy of pain medication. And I just said, no, I'm not doing that anymore. It's making me sick. Let's go to that, which is what he told me I could do. And that fixed everything.
Oh, I love that. Like knowing what the options are ahead of time. I
Oh,
think
it's
so
such a
often we
difference.
don't ask for something different because we feel like, well, they would have given it to me if there
Well,
was an
exactly.
option, right?
Exactly. Yeah. Yeah. And no, not necessarily. They're not going to read your mind. And also, they don't want to offer you something that's quite big guns, as I call it, if you
Right,
don't need
exactly.
it.
You don't get morphine when you go to the dentist, right?
No.
Like we need to titrate this up. We need to have the medication appropriate for the amount of pain you're feeling. Well, nobody knows what pain you're feeling except you.
Well, exactly. It's been a really big learning curve. And when I went back to see the doctor, the surgeon, the surgeon's nurse, because I was like, well, now I'm coming down off the stuff and how do I handle it now? She was really good. She said, Chris, who's the name of my lovely doctor, says it's like a lolly jar. You're not going to have a lolly every day now, aren't I?
Well,
But
why
I
not?
go, yeah, but why not? But you're going to dip in. when you need it and when you know you need it. And you're going to have some duvet days and some, they were really, really kind about just do what you have to do. Don't fight it.
Yes, yes, exactly, exactly. And I think there's another piece in here too, where we are all so different, but because of our fibromyalgia and fibromyalgia being an amplifier, whatever pain you feel, fibro is going to crank it up a few
Absolutely.
notches. We are going to experience pain that's more severe than a non-fibro person in the exact same situation. Like studies have shown this. We have a 2x pain response and more areas of our brain light up when we experience pain. This is a scientifically proven thing. So it's not like you're being a baby,
No,
right? It's not like you're
yeah,
being a wuss.
exactly. And the real game changer for me, Tammy, was when I realized somebody asked me, how's your recovery going? And people do that all the time, sweet. And, oh, you must be mobile now. This is about 4 weeks. And I said to them, well, I have to remember that I've got fibromyalgia as well as having had an operation, and I'm on
Yes.
my own timeline. And it just sort of popped out of my mouth. I hadn't thought about it, but then actually, yeah, I've got no one else. I do know someone who had an operation, hip operation a week before me, but I'm
Yeah, I saw
not.
your pictures on Facebook. You guys were
Yeah, yeah, yeah.
the hippie
There we
club.
are, the happy club. And so I can't compare myself. I have to do what is right for me. And that is about checking in quite a bit too. How are you today, Deb? Actually. Brr.
Right, right. It's about checking in, but it's also about being honest,
Oh, yes. Yeah.
right? Like I think so often we try to white knuckle it through,
Oh,
right? Like just
definitely.
grit our
Yeah.
teeth and bear it, but that actually makes it take longer.
Oh, definitely. And also it's that whole thing of having lost the cues to my own body. And I see this so often in my clients. They're so busy just trying to get through that they can't tell anymore that you're living in a high state of nervous tension a lot of the time. So,
Yeah.
yeah, lots of lessons, lots of lessons.
So, what other types of communication? I'm sure you did a lot of communicating at home,
Oh,
not
yeah.
just during, but probably even before, right? Like, I think it's really important to have some of those conversations before you're in pain, stuck in bed after surgery.
I've got a lot better at that, to saying, actually, I'm not feeling great. I'm going to stay here. This is how I'm feeling now. Just saying it. And Andrew can't tell if I don't tell him. And I did say to him before the operation, I'm going to need you, if I ask you to hold my hand, I'm going to need you to say, I love you before I say it to you. All those things that I know make me feel better. He sort of looked at me like this, quizzically. And then I said, just like my daughters would or my girlfriends would. And he was like, oh, you should have said that.
Right.
The crying didn't help. It sort of put paid to some of that, but we got there in the end. We got there.
Yeah, but I think that that's so important. Having that conversation, like being able to tell him that before you were in the situation where you needed it, right? Because you wouldn't have been able to communicate that in the moment that you
Well, no,
needed it.
exactly.
So having that conversation ahead of time. One of the things that I know you know this, but for you listening, one of the things that we do with our clients is we help them build their flare survival plan. And that exercise came out of one of my clients who was actually having her tonsils removed as an adult, which is not a fun thing. And she knew she wasn't going to be able to communicate with her tonsils out, right? But she also knew she was going to need help. And so we kind of put that plan together ahead of time so that she could have those conversations with her fiance ahead of time to be able to stick it on the fridge and have that plan for when I feel this, this is what we do. And it sounds like you guys kind of did a bit of that.
Well, we managed, we muddled through, and it is absolutely fine now. And as a rule, not even about the operation, as a rule, I'm much, much better at saying that, because I do think part of the feelings that I had after was that lack of independence. I don't want to be a burden, which is what my grandmother used to say quite a bit. I don't want to be a burden, so I want to be independent. But if I'm not being honest with myself about what I can and can't do, and then honest with Andrew, there's no point.
Mm-hmm.
You know what I mean? Like, I'm not helping, am I? I'm not helping myself or
No,
anybody,
no.
really.
And we all want to be independent, and there are things that we cannot do,
Yeah, absolutely.
right?
And I think when you've come a fair way down, I'm so much better in many ways than I was 4 years ago. You sort of feel like you're stepping back to square one a tiny bit, but you've definitely just got to accept that. Not forever.
Yeah, yeah, exactly. So, were there any other communication specific tips that you had for folks?
I don't think so. I just think, if you really struggle with being honest with people, maybe write it down first. I need, this is what I need, especially if you know yourself what you need, but you're struggling to get it across. I think that's probably, and also the other thing I didn't say is taking somebody with you to those medical appointments where you can, and, prepping them beforehand, prepping your medical support person
Yes,
beforehand.
preferably the person that's going to be supporting you, right? Like, don't take your friend that's not even going to be helping you, like, take Andrew, right? I mean, you can only remember so much, so it helps to have a second brain anyway,
Yeah,
but it
exactly.
also helps for them to hear the surgeon saying you're going to need to stay off it or whatever, right?
And when you've had a lot of contact with medical professionals, not all of it has been positive, it can be a really frightening experience. I mean, I'm super lucky that my surgeon is the loveliest man, but it's just that sort of, I don't know, traumatic experience of actually having to talk again to a medical professional can be really hard.
Yep, we all have a little bit of medical PTSD, I think, right? Yeah, yeah. All right, well, let's get into some of those practical recovery. I know you've put together, like have a blog post of a bunch of practical tips. You've got some overwhelm tips for people. So let's dig into those.
So, I mean, I think some of these things are big and some of these are smaller, some of these are less like, yeah. So I'd say the first thing is allow yourself to rest preemptively. It took me a good month to feel like I didn't want to do anything but rest. And I was a little bit shocked by that, but I think I'm now more aware of how easily I get fatigued. Cognitive tasks are really difficult. Let somebody else take the reins on that. Don't expect to be able to make too many decisions. And,
Yes,
I
fatigue
just
really
couldn't.
increases our brain fog because it takes energy to think, or your brain needs energy. Your brain actually uses about 20% of your energy. That's a
That's a
huge
lot.
chunk.
And, we say we need to only use 80% of our energy to save that 20%. But if you've had an operation, I'd say it's much. I don't know if any studies have ever been done on this, but it's actually so much more. I
Yes.
mean, to the point where I still, if I have a shower in the morning by 10 o'clock, I'm like, I need to sit down now. And this is 6 weeks in. So you've really just got to, and patience, honestly, I did write this down. Patience for me has been the hardest thing to actually, but breaking it down into those practical things that I know that I could do, like resting. The thing I was going to say about the cognitive thing and the decision making for us, and this will be different for everybody, but for me, because I've always been the person that has loved to cook, and Andrew doesn't love it as much. We got HelloFresh, and I know this is not always going to be possible, but if you can at least start a couple of months out and start freezing stuff or get something that's easy to put together, it meant that I lay on the couch and my meals appeared. And he's actually
Hmm.
learnt something.
Right. Hungry root is another one that all the recipes take maybe 5-10 minutes, right? So, there's a lot of those types of things. I mean, and depending, some of you may even have friends and family who are saying,
Exactly.
hey, what can I do to help? Well,
Yeah. And
this
say
is a
yes.
great way.
Yeah. Yes. Absolutely say yes. I think you need nutritious meals, that energy again. If you really need to eat well, sleep well, eat well, rest well, those
Mhm.
would be my big
That's your
three.
whole job, getting
It's your
better.
whole, that is your job. Yeah, what are
Yes.
you doing? You're getting better, absolutely. One of the practical things that I've got, and again, the list of things that I've got in it is on my blog, is a bag, which is just a fabric bag. I mean, I know that I've got specific needs because I can't bend forward, I can't bend to the ground, but I think any operation anywhere, you're going to find movement a little bit tricky, but especially if you happen to be on crutches, having that bag with stuff to be able to dip into it keeps you independent. You're not searching for stuff all the time. So it's sort of a mix of practical things you need, like balm and wet wipes.
Yeah, the lotion, the Kleenex, the extra socks.
Maybe a little book of nice little affirmations, something, anything that you need. Yes, socks, definitely socks. Anything you need that's going to help you.
Snacks.
Snacks. Yeah, so you don't have to keep asking or get up all the time and get them. I think a good sturdy chair. I've got this big chair. We've got one of these downstairs as well. And I've got like a plastic square box that Andrew got from the plastic place to put my feet on. You need to have somewhere that you can sit where you can do your circulation exercises if you need to, where you can rest but not lie down. I don't, I mean, obviously you're going to want to lie down a lot, but I think that movement from one place to another is important. And so a good sturdy chair. And this chair is really good because I can hang things on it.
Hang your bag off of it.
Hang my bag off it. Oh, the other thing that's been a real game changer, because I am finding showering really exhausting, is I am now a convert to the wet wipe bath and the
Yep.
dry shampoo. There you go.
Yep.
See? And you can get the wet wipes and the toilet wipes and all the wipes. And we managed to find some sustainable ones, some biodegradable ones, kind to the earth ones. And I wonder whether I'll ever go back, to be honest. I think there might be some days when, especially when I first go back to work, that I'm like, that's me. No shame, I'm clean.
Yep, exactly. Exactly. I think we have to loosen up our ideas of what different things mean, right? Like bathing, for instance. There was a lot of times where I would now do, but for many, many, many years did not wash my hair and my body on the same day.
Well, exactly, because that is exhausting. It is exhausting. And also, like last night, I took a shower at night instead of doing it this morning because I knew we were meeting this morning, and that by the time we met, I'd be ready to just sit down again. For a lot of people, the mornings are really hard for fibro people, and I in particular, I'm one of those people. Although I often seem to have things to do early in the morning. I mean, I've been wearing comfy clothes for 6 weeks, and I still am, But I did get to a point where I felt like I was in my pajamas every day. And so I just found a scarf to put on a bit of lipstick. I just, I mean, to begin with, I did not care. I did not give
But at a
one iota
certain
of care.
point, you
At a
do.
certain point, you do care. And it's not, I mean, yeah, yeah, I think that's
Even
really
something
important.
like buying some cute new pajamas before surgery,
Yes.
right? Instead
Well,
of your ratty
exactly.
old t-shirt that you
I
usually
did
wear to
that.
bed.
Well, I
Yeah.
don't think they're cute, but they're really comfy. And that was really good. And that isn't something else that I forgot to say is taking stuff to the hospital with you. And I asked this in pre-op, and she was really good about this. Like I've got a pillow that I adore with a silk pillowcase, which is really comfy. That came with me. Anything that you generally use,
Those little comforts of home,
those
right? Little
little comforts of
touches.
home.
Yeah.
Yeah. And making sure you've got those, making sure you've got just a torch next to the bed if you have to get up. There's a ton of things that you can do to make yourself easier and make things easier for you. And again, as I did beforehand, prioritizing my sleep afterwards.
Hmm.
Another one of my mum's saying was, if you're sleeping, you're healing. And now that I know that that's not quite true for fibro people, I would have corrected her. But I mean, I think, we do find it harder to sleep. We find it harder to get deep sleep. And so,
The saying is still true. It just, our sleep isn't like we've got to fix our sleep a bit.
once we get that sleep, we are healing. So, yeah, I would say that that's definitely a thing that is really, really important to me.
Yes. And don't be afraid, sleep as much as your body wants to, right? Like if
Exactly.
you feel like taking a nap, take a nap.
I've always been a bit bad at this, Tammy. I'll fight. I'll
Me
go,
too. Me
oh, I'll
too. Yep.
just, I mean, maybe not so much at night, but during the day. But for the first 4 weeks, I'm a meditator. And I know not everybody is, but there are a lot of yoga nidras online that are very accessible and free. I listen to something called Insight Timer, and I put it on, and basically it's a yoga sleep. So they just circulate your body and it just talks you through it. You don't have to do anything. You can follow if you like. And the one that I've got, she says at the upfront, if you fall asleep, it's fine. So I'm like, yes. So just every day I would do the same thing. I'd lie down after lunch with that. And I guess probably for the first 3 or 4 weeks, I did have a sleep in the day as well. And if I didn't do that, then I'd find myself wanting to nod off and resisting it.
Mhm. And if you feel like you want to take a nap, there's probably a reason. Like your body is giving you the,
Definitely. Your
you
body
know,
is telling you. And all the other things
and
will stop
honor
working,
that.
like you can't think or you get grumpy or,
Yeah.
everything starts to go. And again, patience has been my biggest lesson in this whole journey. You've just got to remember that you're just doing things slower for a while. That's not the end of the world.
And fibro healing takes longer.
Yeah.
right? Like, just like fibromyalgia is an amplifier pain wise, it also means that it doesn't matter if you get a cold, if you have surgery, like it's just going to take you longer to heal. And to embrace that, to know that up front, I think
Well, it takes away,
some of the stress. Yeah.
yeah, it takes away the resistance to the thing. You're just like, it's fine. And to be honest, I haven't felt that I've missed out at all by basically not going out that much. I've gone out a few times, but in the last wee while.
Yeah. And the idea is that this is going to help you go out more later.
Well, exactly. Yes, say no to say yes. That's
Exactly
your
right.
mantra, and I stick to that. And I've had to say no to some things that I really, really wanted to do. And I think that's something perhaps that people without fibromyalgia don't fully understand how difficult that is, that you do have to make those choices. And it's not because you want to, you just know that it's better for you.
Hmm.
But if you continue to go, right, I'm doing that, and then I can do this, which I
Yes,
really
exactly.
want to do, then you're not missing
Exactly.
out. You've got a
Yeah,
choice.
that mindset shift of I can't do that because to I'm choosing not to do that
Yeah,
because it'll
exactly.
let me do something that's
Yeah,
even more important to me.
yeah. And you
Yeah,
need to have that sort of hierarchy of what's the most important thing.
exactly right. Exactly right. Any other practical tips, thoughts, or anything on the preparation or communication that we haven't covered yet that you want to make sure?
I don't think so. As I said, I've got a list of things, practical tips that people can access. I just think the most important thing is to give yourself some grace and just know that you've done this for a reason and it will make your life better and that other people have gone through the same thing. There are people you can talk to, there are places you can find comfort, and you're not alone.
That's right. That's right. Yeah, exactly.
I'd say that's probably it.
Yes, yes. Now, for those of you listening, if you are interested in getting in touch with Deb, she is one of the coaches that you can schedule a consultation with at our Find a Coach page. It's just findafibrocoach.com. Just go there, you can fill it out. She is one of our certified coaches that you can schedule with. And then, Deb, for the resources that you have for people, you've got one of them is the blog post with like practical surgery tips, right? And then the other thing that you have is like a download or something on
Yes, it's a
helping with
PDF download and it's called Simple Overwhelm Strategies. And I do find that, at a certain point and also every now and again, we all get overwhelmed.
Oh, absolutely.
You know what I mean? Like
Yeah.
it's not just if you are feeling really down, it's a list of things that are free and simple that you can do to just shift yourself from that feeling of complete overwhelm. So you can use it in all sorts of different circumstances. And it's things that I've used. So I've put it together and things that I've used with my clients.
Awesome. And we will have a link to that in today's show notes, which is fibromyalgiapodcast.com/142. But you also have those on your website, which is
DebThompsonCoaching.com. And again, it's in the show notes. Yeah.
yes. I didn't want to say the wrong URL. I was pretty
Yeah,
sure
yeah, yeah.
that's what it
Oh,
was,
I had
but
a panic for a minute there, Tammy, the old cognitive load. Ooh, ooh, what's my name?
Awesome. Awesome. So, as we wrap up, Deb, I would love for you to do two things. So, first, I would love for you to talk a little bit about the work that you do with your clients, who you work with, what kind of problems you help with, what are some of the results that you get. And then I would also love for you just to speak to that person who's listening right now who has either a surgery planned or is thinking they might have to, and just give them some words of encouragement.
Okay. You might have to tell me those two things, the second thing again, once
Absolutely.
I've done the first thing. Okay, so I work with women with fibromyalgia primarily, and I help them to break that cycle of pain and fatigue. Because if you are constantly in a cycle of pain and fatigue, you're never going to heal. So basically, the aim of the thing is to heal. And for that to happen, we need to get our nervous system down. And so it's just about finding out what everybody needs individually, really, but there are some commonalities amongst most people with fibromyalgia. So I generally work with people who overachievers, boom and bust, who have lots of responsibilities and have just not found the time or the way to look after themselves first. So many of the people that I work with are mothers, carers, daughters, but people that are putting other people before themselves and hitting the wall. And so the kind of work that we do together is to look at what you need to do that healing. And a lot of that is, thank you very much, Tami, because I follow exactly what you taught me about gathering data about the kind of things you're doing and looking at that and thinking about what you might want to do differently. But then the key thing is finding what works for you in your life.
Mm-hmm.
So what's your why? What do you want to get better for? And what are the things that are going to work for you? And it's going to be different for everybody. And that's one of the reasons coaching works, is because it's for you individually in your life, not some sort of cookie cutter approach.
Right. Yeah.
I think that's probably, have I answered the question?
Good job.
Good.
That I would love for you to just like speak from your heart to those who are, have maybe a surgery on the horizon.
Okay. I think it's natural to be nervous. I mean, I guess I've got the benefit of hindsight, having done this twice, but I do think there are things that you can do. And the most important thing to do is to keep your nervous system as suppressed. I don't know what's the word.
Calm.
Calm, as you possibly can, that it's going to be okay. And you are doing this for a reason. And the reason is to feel better in the long run. And that even if you're feeling like I did, quite overwhelmed afterwards, if you say to yourself, this isn't going to last forever, that you will get through that quicker. I think allowing it to wash over me actually allowed me to work through that sort of grief that I was feeling. Use your practical things that you can, as we've said a few times, there's a list there. And yeah, it's hard, but it's not insurmountable, and it's worth it.
Absolutely. And if you feel like you need some help with the process.
Oh, yes. Yes, I forgot the most important bit. If you feel like you need some help with the process, I can help you. I can 100,000,000% help you.
I mean, that's what you did, right? You went to one of our coaches
Oh,
and
definitely.
had a conversation,
Oh,
right?
definitely.
Giselle
Yeah.
helped with that. So
Oh, definitely. Yeah. And I didn't have that information. I didn't know that information. So I needed to ask somebody else. And I mean, that's the other thing, finding a coach helps you to find someone who not only has the experiences you have, so they see you, they understand you, but they've been trained. Well, I shouldn't use the third person. I have been trained.
That's right. That's right. So if you are facing a surgery and you are feeling overwhelmed, go out, grab Deb's downloadable PDF with those simple strategies for overwhelm, but schedule a call with her too. Having somebody by your side to walk with you and to, like Deb just said, share from our own experience, but also kind of help you break it down. And what are those things that you need to do? What can you have somebody else do? What things don't need to be done at all? How do you prioritize them? All of that stuff can get super overwhelming. And having somebody that you can have that conversation with instead of trying to just figure it out all in your head can make things so much easier.
But also someone who's there who can support you if you're feeling it's hard. That's the kicker.
And to remind you that this too will pass. Oh, well, thank you so much, Deb, for sharing so much of your story and your experience. I think, especially having had those two surgeries just a few years apart, same team, but such a different experience, I think is such a great example of what can be done to improve our experience.
I guess, I was more empowered. I haven't said this, but it just when you say that, this is what the difference was. I felt empowered by all the things that I had learnt and knew that I could do that I didn't have the first time.
That's right. That's what it's all about. All right. Thank you again so much, Deb. And for you listening, stay tuned. There is a bunch of stuff that Deb and I talked about today that actually directly relates to certain other podcast episodes, like our Flare Survival Plan, saying no to say yes, a lot of those things. So stay tuned. I will give you some of those episodes and other resources in just a minute. And that wraps up my interview with certified fibromyalgia coach, Deb Thompson. Remember, go to today's show notes to get her free bonus resources at fibromyalgiapodcast.com/142. On that same page, we'll also have where you can connect with Deb on her website and on social media. Remember, she is one of the coaches that you can choose to meet with through our Find a Coach page. Just go to findafibrocoach.com and you'll be able to fill out an application and schedule with Deb. As I mentioned at the beginning of this episode, there are several other episodes and several other resources that go more deeply into some of the topics that we discussed today. The first one that I would recommend checking out is episode 78, Build Your Flare Survival Plan. This is the activity that I mentioned in today's episode that I took my client through who was preparing to have her tonsils removed. This is something that, honestly, all of my students do as part of the Certified Fibromyalgia Advisor class. There's a worksheet to go with the activity that really helps you think through what those early warning signs are before you get a flare and what you can do to help mitigate your symptoms. You'll also find a link to that episode on today's show notes page. Deb also talked about how she learned from me how to say no so you can say yes, which is actually the title of episode number 12. That episode goes a lot deeper into that concept and how you can shift your mindset a bit. That mindset I was talking about from I can't do this because of my fibromyalgia to I'm choosing not to do this because I want to feel better. There is a big difference between those two thoughts. So episode 12 is a great place to start on that. Again, you'll find a link to that episode in today's show notes at fibromyalgiapodcast.com/142. Deb and I also talked about our Be a Coach and Stories of Hope special podcast series. These special episodes are available as part of the regular podcast feed, just like the others I mentioned. But we're getting so many episodes now that they can be harder to find and harder to just list them out for you because there's so many now. So what we've done is created a special free private podcast feed that you can sign up for. There's a link in today's show notes, and all of those episodes will be delivered directly to your phone or wherever you listen to podcasts as a separate list, making it a whole lot easier to find what you're looking for. So just go to today's show notes, fibromyalgiapodcast.com/142, and you can sign up for the free Be a Coach series or they are separate. You can also sign up for the free Fibromyalgia Stories of Hope podcast series. That is that list of episodes that Deb was talking about where you can actually hear from real people, their real experiences, and how they were able to get better. Now, I've got this week's listener shout out for you, and this comes from an email we received from Rhonda in Florida. She said, "Your podcast has been such a wonderful help, actually a game changer. I was feeling weary from dealing with fibromyalgia. Your encouragement, practical tips, and information have really given me a better outlook." Thank you so much for that, Rhonda. And I know you sent that note in a while ago, so I would love to hear an update on how you're doing these days. You know, dealing with fibromyalgia day after day really can be exhausting. There are no days off. And it can really help not to face that all alone, whether that's working with a coach like Deb or just having me in your back pocket to listen to through the podcast. None of us can do this alone, not even me. I'll see you back here next time. And until then, please be gentle with yourself. And that wraps up another episode of the Fibromyalgia Podcast. I'm your coach, Tami Stackelhouse. For daily doses of hope, inspiration, and practical advice, come hang out with me on Facebook. Visit facebook.com/fibrocoach to find my personal coaching page and connect with me directly. To find the show notes, additional resources, or to schedule a consultation with me or one of my coaches, visit fibromyalgiapodcast.com.